Hi, my name is Dr. Jorge Flechas. I'm a medical doctor with a master's in public health, and today we are at the Nevada Center in Carson City, Nevada. We're going to be discussing the issues of autism as it relates to a hormone called oxytocin. Next. What we have found is that autism belongs to a spectrum of different disorders. There are many researchers who feel that ADHD, or attention deficit disorder, is part of the spectrum, as well as a disease known as Asperger's syndrome, and PPD-NOS and autism, as well as psychologically and behaviorally defined as communication problems, stereotypic behaviors, and social interactions. The physicians who deal with this have to deal with whether autism is a disease or a disorder. And when we look at the underlying pathology, on the next slide, we see that we have to look at the issues of whether we treat the cause or whether we treat the symptoms. Illustration here would be something like attention deficit hyperactive disorder. The cause of this has not been found. The treatment for this is the use of stimulants. Causes of this can be problems with low iron, omega-3 fatty acid deficiency, exposure to lead, low glutathione levels, and oxidative stress. And within the last 4 or 5 years, there's been research to show that iodine deficiency in the early months of a pregnancy or in the early few months of a fetal life can predispose towards development of attention disorder. Treatment would be such things as supplements such as zinc, iron, pycnogenol, omega-3 fatty acids, carnitine, nutritional treatments, detox treatments, and perhaps even the use of stimulants. Probably the strongest deterrent for development of attention deficit disorder is to give iodine 12.5 milligram tablets per day early on in a pregnancy and all the way through the pregnancy. No iodine in early fetal life will produce a problem of mental retardation known as cretinism. In Japan, the daily intake of iodine is around 13.8 milligrams of iodine per day. The average intake of iodine in the United States right now is set at about 150 micrograms per day. In essence, we here in America eat about 100 times less the amount of iodine as to the Japanese and even some of the Koreans. In our next slide, we look at the issues of autism and the pathophysiology of that. And what we find is that there have been reports of cerebral hypoperfusion, inflammation of both the cerebral and gastrointestinal tracts, dysbiosis, mitochondrial dysfunction, oxidative stress, impaired glutathione production, and environmental toxin exposures. In autism, we have seen a pathophysiology of a problem of a hormone insufficiency, such as oxytocin and melatonin in the brain. We'll be discussing these later on in our discussion. What is interesting is that there has also been a problem of hyperserotonemia. This is high levels of serotonin in children with autism. The severity of this correlates with the severity of autistic behaviors, so that increasing the serotonin levels in many children with autism actually makes them worse rather than doing better. During our series here, we'll be speaking about what's called evidence-based medicine strength of evidence. And basically what this says is that rather than guessing at what might be happening in patients with autism, We do studies on patients, and from those studies, we find the studies that have the strongest evidence to suggest that a particular treatment may be of help. In this particular case, a type A treatment would be one that is supported by at least 2 prospective randomized controlled trials or 1 systematic review. A B trial would be one supported by at least 1 prospective randomized controlled trial or 2 non-randomized controlled trials. A C for evidence-based medicine is supported by at least 1 non-randomized controlled trial or 2 case studies. And if a trial or a treatment has a D level to it, it basically says there's troubling inconsistencies or inconclusive studies or studies reporting no improvement. As you can see in our next slide, we're looking at placebo. As high as 30 to 37% in all studies in children with autism have been seen to occur. This points to the need as to doing what's called a double-blind placebo-controlled trial or study. In this case, neither the patient, the parent, nor the doctor know whether the patient is getting the controlled medication or nutrient, and there are placebos that are thrown into that, and as a result, this way we try to eliminate the placebo effect. However, we also need to treat children now and cannot always wait for these types of studies to be done. Consider the treatment with the use of nutrients or supplements. There's not much financial gain for something like this to occur, since it costs so much for a company to patent a particular supplement. As a result, many of the studies that would be done on supplements can't be done just for the cost of these treatment. We need to evaluate the risk-benefit ratio for each one of the treatments that are out there. A caveat would be that a double-blind placebo-controlled study can cause you to lose sight of the individual patient. There is a supplement out there called DMG, dimethylglycine. There have been 2 negative double-blinded placebo-controlled studies in autism. However, dose in the studies were lower than typically used. DMG has been ranked number 17 by parents on the autism list of treatments. Some children manifest improvements with dimethylglycine, including speech. There's also been a product out there called Secretin, and they have found that it didn't work as well for children with autism. One of the caveats that we need to remember is that over 50% of what is done in medicine is off-label, suggesting that a particular medication or drug or a supplement might have been developed for this particular reason or that particular disease, and yet in children with autism this may be of help, and physicians have seen this happen, and as a result they use it and it's considered to be off-label. Off-label means that the FDA approved it for a particular reason, and yet we use the medication for a totally different reason. Examples of a Class A study in autism can be seen with our next slide. And here we find that the hormone melatonin, which is a hormone released when the body goes to sleep. There have been 2 randomized, double-blinded, placebo-controlled studies that have demonstrated improvement in the amount of time it takes to fall asleep, the number of nighttime awakenings, and the length of sleep compared to both baseline and placebo. Many children with autism have a very difficult time going to sleep, and you'll see a 4-year-old that's still awake at 2 and 3 and 4 o'clock in the morning. Autism, in our next slide, is found to be a developmental disorder characterized by 3 core symptom domains: speech and communication abnormalities, social functioning impairment, and repetitive behaviors and restricted interest. Autism often has coexisting neuropsychiatric disorders, including seizure disorders. If you look at all children, about 1% of all children have problems with seizures. In children with autism, 33% of the children go on to develop problems with seizures. There is also problems with attention deficit hyperactive disorder, affective disorders, anxiety disorders, obsessive compulsive disorders, and Tourette's disorder. Oxytocin, which is what we're planning to concentrate on the most here, is a 9 amino acid peptide that is synthesized in the paraventricular and supraoptic nucleus of the hypothalamus. The hypothalamus is the area of the brain just above the pituitary. Oxytocin as a peptide is the highest concentration peptide in all the brain, and it's released into the bloodstream by axon terminals in the posterior pituitary, where it plays an important role in facilitating uterine contractions during partition and in milk letdown. What we have since learned is that these microtubules, these axon terminals that release things into the posterior pituitary, have also now been shown to be going to just about every major location in the brain. So that it's the oxytocin is not just released in the posterior pituitary, it's released throughout the whole brain structures. In our next slide, we find that oxytocin is the structurally similar peptide to that of arginine vasopressin. And these 2 hormones are released within the brain, where they play a key role in regulating affective behaviors, including sexual behavior, mother-infant and adult-adult pair bonding formation, and social memory and recognition. The importance of this is that if you look at a small baby that is born, the little girls, their brains are marinated in estrogen, progesterone, and oxytocin, so that by the time a little girl is 1 year old, she's already developing characteristics that are unique to the females of the human. Flip side of the coin is that little boys produce high doses of testosterone, Mullerian inhibitory substance, and AVP. And these hormones help to make the brain into the brain of that of a male. Oxytocin has been implicated in repetitive behaviors and stress reactivity. Given that oxytocin is involved in the regulation of repetitive and affective behaviors, and that these are key features of autism, it is believed that oxytocin may play a role in autism, and that oxytocin may be an effective treatment. When we look at the blood levels of oxytocin in normal people, we see that if you were to randomly pull the blood in a normal human, we would see a level of 1 to 4 picomolar per liter, or 1.25 to 5 nanograms per liter. Women at ovulation, their oxytocin levels peak to about 408 picomolar per liter, or about 5 to 10 nanograms per liter. Now, they have some of the original studies that were done back in 1998 showed that social impairments are central to the problem of autism. The neuropeptide oxytocin has been implicated in the regulation of social behavior in animals, but had yet to be, this hormone had not been examined in patients with autism. To determine whether autistic children had abnormalities in oxytocin, the researchers took a blood sample and studied the plasma of 29 autistic patients and 30 age-matched normal children, all prepubertal, and were analyzed by a radioimmunoassay for levels of oxytocin. The results in the next slide showed, despite individual variability and overlapping group distributions, the autistic group made significant lower plasma oxytocin levels than the normal group. Oxytocin increased with age in the normal, but not in the autistic children. Elevated oxytocin was associated with higher scores on social and developmental measures for the normal children, but was not associated with lower scores for the autistic children. These relationships were strongest in a subset of autistic children identified as being aloofed. The conclusion of that study, although making inferences on central oxytocin functioning from peripheral measurement is difficult, the data suggested that oxytocin abnormalities may exist in autism and that there are more direct investigations of central nervous system function would be warranted. And basically, the researchers were concerned that just because you can measure oxytocin out here in the bloodstream, was that reflective of a problem with oxytocin in the brain. This study was done back in 1998. And again, on the next slide, we see that the autistic patients had a level of oxytocin at 0.64 picogram per ml. The controls had 1.16 picogram per ml. And basically, there was an increase in oxytocin with age in the normal population. However, there was no increase in oxytocin levels in children that were autistic. There was an increase in oxytocin levels in the normal patients. In our next slide, we see that in 2001, Dr. Green and associates published a paper showing the following. Oxytocin was synthesized as a prohormone that is subsequently processed into peptides. These peptides are the bioactive aminated form, oxytocin, and the C-terminal extended peptides called oxytocin-glycine, oxytocin-glycine-lysine, and oxytocin-glycine-lysine-arginine, which are designated in the study as oxytocin or OT-X. As an extension of their previous studies where they had found low levels of oxytocin in autism, studies were conducted to maintain whether there were changes in the oxytocin peptide forms of the hormone in children with autism. 28 male subjects were selected in our next slide, and they had been diagnosed as having autistic disorder through observation and semi-structured interviews. And they were compared with 31 age-matched non-psychiatric control patients. Using oxytocin antisera with different specificity for the peptide forms, they measured oxytocin versus oxytocin to the peptides that were joining the oxytocin molecule. The results showed that there was a decrease in the level of oxytocin, but there was an increase in the level of oxytocin's peptide. In the control group, this was not true. Conclusion of the study was that the results suggest that children with autistic disorder show alterations in the endocrine oxytocin system. Deficits in oxytocin peptide processing in children with autism may be important in the development of this particular syndrome. As we can see here in our next slide, the children with autism had levels of oxytocin at 0.8 plus or minus 0.9. The controls had levels of 1.4 plus or minus 0.1. The children with autism who had the oxytocin peptide had levels of 2.9 plus or minus 2.9, and the controls 2.0 plus or minus 0.22. The ratio of oxytocin peptide to oxytocin in autism was 4.5 plus or minus 0.59, with the controls at 1.8 plus or minus 0.25. Now, basically, this study says that the children with autism are making oxytocin, but it's oxytocin in its pro-hormone phase, and basically the hormone is attaching it, has attached to it some peptides, and the child is having a very difficult time detaching these peptides from the oxytocin molecule. As a result, very little free oxytocin out in the bloodstream, but lots of oxytocin peptide. And basically that says that the enzyme responsible for the cleavage of the peptides off the oxytocin molecule is defective. Another way that we can look at this is, in the next slide, is looking at melatonin and autism. There is a gene called the ASMT gene encoding the last enzyme of melatonin synthesis. It's located on the pseudo-autosomal region 1 of the sex chromosomes. This is deleted in several individuals and is seen in autism spectrum disorders. There is a decrease in the ASMT activity on blood platelets and or cultured cells. There is decreased melatonin seen in individuals and in patients with autism spectrum disorder. Low melatonin levels caused by a primary deficit in ASMT activity could possibly be a marker that could be used in the future for assessing the risk factors for ASD. I think probably the most important statement that could be made here is the fact that a little girl has two X's. These are her sex chromosomes. They have two X's, and little boys have one X, one Y. And it's interesting that in autism, there is 4 boys to every 1 girl who develop this particular disease. And as you can see, it's an enzyme that's defective in melatonin production. It's an enzyme that's defective in oxytocin production, suggesting that the problem with autism, it may be at the genetic level in the making of certain enzymes that are needed for normal function of the body. Hence, looking at evidence-based medicine, we find that melatonin, 2 randomized double-blinded placebo-controlled studies have demonstrated improvement in the amount of time it takes for the child to fall asleep, the number of nighttime awakenings, and the length of sleep compared to both baseline and to the placebo. I am the medical owner of a medical laboratory where we can measure oxytocin blood levels. Before treatment with oxytocin, it is felt by many in the medical community that a patient should have their blood levels measured first. You can call us at 828-694-1144 to order your oxytocin test kits. There is increasing evidence that this hormone may be important, more important than we've considered. More doctors, or most doctors, think of oxytocin only in the context of the milk letdown reflex, uterine contractions as seen in time of labor for pregnancy, or the human sexual response. You can look this up on Wikipedia under the word oxytocin. As seen from the previous slides, autism is associated with low levels of oxytocin and high levels of oxytocin peptide. Looking at evidence-based medicine, the strength of evidence is best supported by at least 2 prospective randomized controlled trials. In our next slide, we find that intranasal oxytocin improves emotional recognition for youth and autism spectrum disorders. And in a double-blinded, randomized placebo-controlled trial, oxytocin nasal spray was given, or a placebo was given to 16 male youths between ages 12 to 19 who were diagnosed with autism or Asperger's disorder. Now, Asperger's is felt to be a high-functioning autism. In comparison with the placebo, oxytocin administration improved performance on the reading of the mind in the eyes test. This study provided the first evidence that oxytocin nasal spray improves emotional recognition in young people diagnosed with autism spectrum disorder. The findings suggested the potential of earlier intervention and further evaluation of oxytocin nasal spray as a treatment to improve social communication and the interaction in young people with autism spectrum disorders. Another study that was done in the year 2010, it was just published, showed promoting social behavior with oxytocin in high-functioning autism spectrum disorders. The behavioral effects of oxytocin were investigated in 13 subjects with autism. And in a simulated ball game where participants interacted with fictitious partners, we found that after oxytocin inhalation, patients exhibited stronger interactions with the most socially cooperative partner and reported enhanced feelings of trust and performance. Also, during free viewing of the pictures of faces, oxytocin selectively increased patients' gazing time on the socially informative region of the face, namely the eyes. My ability to look into another human's eyes and read what their facial expressions are saying is controlled by oxytocin. You will notice that many patients with autism do not look at their the person that they're speaking to very often in the eye. Thus, under oxytocin, patients respond more strongly to others and exhibit more appropriate social behavior and affect, suggesting a therapeutic potential of oxytocin through its actions on a core dimension of autism. Dr. Hollander, on our next slide, in the year 2003, did a randomized, double-blinded, with placebo challenge with the use of oxytocin. And they gave IV oxytocin to these patients, 15 adults with autism or Asperger's. The results with ASD or autism patients showed significant reduction in repetitive behaviors following oxytocin infusion. That was 86% decrease as compared to the patients that received placebo, a 40% decrease. In the year 2006, Dr. Hollander did another study, again randomized, placebo-controlled, double-blinded crossover study of 15 adults, 14 men, 1 woman, with either Asperger's or autism. And what they did is they took some neutral sentences and read these sentences with different levels of intonation, such as the sentence could be read in a happy format, indifferent format, angry format, or sad format. From what was seen, the patients had an improvement in their ability of reading, being able to pick up when a sentence was being read happily, angrily, or sad when they were under the influence of oxytocin. As can be seen from the field of evidence-based medicine, the strength of evidence that the use of oxytocin fits class A, that is, oxytocin can be used in autism, can be supported by at least 2 prospective randomized controlled trials. And basically what we're seeing here is that we have researchers from different areas of the country doing the studies on autism, and these different research groups were able to show that oxytocin had a very beneficial effect to the patients with autism. Frankly, this clears the way for medical doctors to use oxytocin for the treatment of autism. In the United States, oxytocin comes as a nasal spray known as Syntocin. Comes as 40 international units. Comes as Pitocin injectable. It comes as an oral troche, and which can be gotten from University Compounding Pharmacy in San Diego, or an oral pill from Belmar Pharmacy in Lakewood, Colorado. 1 milligram of oxytocin is about 450 international units. The dose that can be used for individuals will depend upon research that's been recently done at Duke University and published back in 2009. The oxytocin dose will depend upon the evidence of abnormal oxytocin receptor genes and thus receptor malfunction. I have been speaking to some of the researchers, and they have told me that higher levels of oxytocin may be necessary in patients with autism and not the low levels that we normally see in normal human beings because of the receptor gene abnormality. Hence, it can be concluded that patients will need somewhere between 10 international units as what we would use on a small child to maybe 40 international units for an adult on a daily basis. Researchers have told me that they have tried less than 10 international units and it did not work. The half-life of oxytocin in the plasma is about 3 to 5 minutes. During nursing a child, the blood levels may reach 12 to 25 nanograms per liter in the mother. When estrogen levels peak at ovulation, oxytocin levels can reach 5 to 10 nanograms per liter in a woman. Estrogen and thyroid T3 stimulate the making of oxytocin. In our slide called Oxytocin, there have been some myths that have developed about oxytocin. One of those myths says that if you give oxytocin and put it through the bloodstream, that it cannot pass the blood-brain barrier and affect brain function. But from the studies that we've quoted above about oxytocin and ASD, or autism spectrum disorder, we see that it does cross the blood-brain barrier and can affect brain function. Another myth is that you can take oxytocin and put it in the stomach and it'll get destroyed. However, Belmar Pharmacy has proven that it can make a pill of oxytocin and that the pill can get past the stomach and get good blood levels of oxytocin in the bloodstream. On oxytocin side effects, we see that due to the similarity of oxytocin to vasopressin, that oxytocin can reduce the excretion of urine slightly. In high doses, it can result in hyponatremia. I have had one patient who in the past would gain 8 pounds of weight in 3 days due to fluid retention. So once a patient is started on oxytocin, check their weight before starting therapy and 3 days later. If weight gain is present, you can give them a mild diuretic to get rid of that extra fluid. Remember, 1 gallon of water equals approximately 8 pounds of weight. We have seen that oxytocin can give you some side effects. These include such things as increasing trust and reduced fear. It affects your generosity by increasing empathy. There are certain learning and memory functions that become impaired. impaired memory retrieval in certain adversely events that require memory task, and can facilitate learning and memory specifically for social information. Now, one of the things that we have seen with oxytocin as a side effect is that it can lower the ACTH production from the pituitary. ACTH is a hormone produced by the pituitary to stimulate the adrenals to make cortisol. Hence, you will see a lower cortisol production from the adrenals. If given oxytocin to a person and the individual says that they find themselves feeling worse when they should feel much better, consider adrenal insufficiency of cortisol to be present. Stop the oxytocin and do an adrenal workup about a week later and do a 24-hour urine for free cortisol. If low, consider cortisol replacement therapy with your physician. Oxytocin's biological function. If an injection of oxytocin working as a vasodilator to open up the blood supply to the brain, and in this case the probe is a 10-unit injection with 1/4 of a cc of lidocaine 1%. Usually this injection should occur in a medical office. And if the oxytocin induces a headache, consider an obstruction of the foramen magnum by the cerebellar tonsils. What we're talking about here is the fact that oxytocin increases the blood supply to the brain. And you can see this when you give an injection to the patient. You will see the ears will turn as hot red as the lips. But because you've increased the blood supply to the ears, you have also increased the blood supply to the brain. And with more blood supply, you make more cerebral spinal fluid. And if the patient says that they get a really bad pressure-like headache, that usually will signify that there's an obstruction right here at the base of the spine of the head, where the brainstem turns into the spinal cord. There's an area there known as the cerebellum, and the cerebellum has some tonsils on it. These are not the tonsils of the mouth, it's the tonsils of the cerebellum. They can block off the foramen magnum, cause a pressure-like headache, and this will last for a few hours before it finally goes away. This can be either a Chiari malformation or a hypoplastic posterior fossa. From regular routine MRIs that have been done in the New England Journal of Medicine within the last few years, they have shown that of 3,000 patients who had MRIs, approximately 1% had problems with this type of disorder. And here's a picture of it. What you will see is that the cerebellar tonsils right in the middle to the right are extending beyond the skull and forming what looks like a small little triangular area outside of the brain. This triangle is so severe that it will not allow fluid from the brain to go down into the spinal cord all the way down to the tailbone. And anytime fluid is made by the brain, it gets stuck inside the head and cannot get out. As a result, the patient will complain of a pressure-like headache. At its worst, prior to the modern era of neurosurgery and the things that neurosurgeons have developed, whenever a Chiari malformation occurred in children in the past, this is what they would look like. And what you see here is a picture of a baby who has an enlarged head from a Chiari malformation, where the brain fluid could not escape out of the spinal, down into the spinal canal, and because of the increased pressure, the baby's head became big. So if by giving oxytocin a child starts complaining of pressure-like headaches, consider this to be a problem and have it worked up by your medical doctor. Other uses for oxytocin in autism would be as follows. There is such a thing called anxiety, where in autism spectrum disorder, in a group of patients 6 years old to 12 years old, there was seen generalized anxiety in 24% of these children. In another study, they found 43% of the children with autism having severe anxiety. I have taken care of patients with autism who were on at least 4 or 5 different drugs just to control the anxiety. It's felt to be due to abnormalities in an area of the brain called the amygdala. Jankett reported significant correlations between anxiety depression scores, the total amygdala volume, and the right amygdala volume. Now consider this. You have an area in the brain just behind the ear called the temporal lobe. In that area you have what's called the hippocampus, where you store your routine regular memory things. Like if I gave you a piece of paper and said please memorize, it would probably be all stored on the hippocampus. If a memory is stored with emotions, such as you have a very emotional event that occurs with a particular event or a memory, then it gets stored into the area called the amygdala. Now, oxytocin has the ability to get rid of anxiety that's been seen in male mice. And we can also tell you that malfunction of the amygdala also is a source of why the brain develops severe anxiety problems. Here's another study called Oxytocin Increases the Gaze to the Eye Region of the Human Face. It is oxytocin that controls how you look at a person by looking straight into their eyes and looking at their face and studying what happens. In non-human mammals, oxytocin has a critical role in peer recognition and social approach behavior. In humans, oxytocin has been found to enhance trust and the ability to interpret the emotions of others. It has been suggested that oxytocin may enhance facial processing by increasing focus on the eye regions of the human face. Again, in a double-blinded, randomized, placebo-controlled trial between subjects, they tracked the eye movements of 52 healthy male volunteers who presented with 24 neutral human faces with intranasal administration of oxytocin or a placebo. Participants that were giving oxytocin showed an increased number of fixations and total gaze towards the eye region compared with the placebo participants. The conclusion of the study was that oxytocin increases the gaze specificity towards the eye region of the human face. This may be one mechanism by which oxytocin enhances emotional recognition, interpersonal communication, and social approach behavior in humans. These findings suggest a possible role for oxytocin and the treatment of disorders characterized by eye gaze avoidance and facial processing deficit. And again, looking at children with autism, you'll notice they will not look you too much in the eye, and in fact they tend to look away from you rather than looking straight at you as far as their autism is concerned. Now there is a study called the amygdala theory of autism, and again what they found was that autism involves deficits in social intelligence. It is plausible that autism may be caused by an amygdala abnormality. They reviewed evidence for an amygdala defect in people with autism who were well known to have deficits in social behavior. This includes a detailed summary of their recent functional studies judging from the expressions of others' eyes that the other person may be thinking or feeling. In this study, the patients with autism or Asperger's did not activate the amygdala when doing mentalistic inferences from the eyes. The amygdala is therefore proposed to be one of the several neural regions that are abnormal in patients with autism. The researchers concluded that the amygdala theory of autism contains promise and as such suggests new lines of research. Another study says oxytocin improves the ability of mind reading in humans. The ability to read the mind of other individuals, that is, to infer their mental state by interpreting subtle social cues, is indispensable in human social interactions. The neuropeptide oxytocin plays a central role in social approach behavior in non-human mammals. Again, in a double-blinded, placebo-controlled, within-subject design, 30 healthy male volunteers were tested for their ability to infer the effective mental state of others using the reading of the mind in the eyes test after intranasal administration of 24 IUs of oxytocin. Oxytocin improved the performance as compared to the placebo. This effect was pronounced more difficulty compared with the easy items. The data suggested that oxytocin improves the ability to infer the mental state of others from social cues in the eye region. Oxytocin might play a role in the pathogenesis of autism spectrum disorder, which is characterized by severe social impairment. Based upon what we have read, this helps us to understand that in order to the human brain to be developed as that of a female, women need lots of estrogen, progesterone, and oxytocin. Oxytocin makes it easy for the woman to be able to read the mind of others, such as a wife who comes up to her husband and says, "Honey, you don't look like you feel well." Most men will deny it and sit there and say, "Well, I'm just fine." Yet the woman can sit there and read what's going on with her husband and says, "He's lying to me because I know better." We know that little girls at age 4 who ask their fathers or their grandfathers to play house with them will pick up the signals that the adult is not reading or playing with them. And the little girl will sit there and say, "You're not paying attention," or "You're not doing very much to help me with this game that we're playing." And what happens is that little girls playing with their fathers or with their grandfathers or their brothers learn to read the minds of others and learn to read their body expressions, so that when later on in life they go out on a date at age 20, 25, even 50, that women, because of their training with oxytocin, can say to a man, "How do you like my dish that I presented to you tonight?" And the man says, "Oh, it's okay." And yet the woman, because of what she sees in his eyes, reads his face, can say, "He's lying to me. He didn't like it." So oxytocin helps improve the mind reading in humans, and this problem is not present in children. That is, children with autism cannot do mind reading, and therefore they have a difficult time with social interactions with their fellow human beings. If you have any questions or have any comments, please call us here at the Nevada Center. We'll be happy to help you where we can. Thanks. Bye.
For more information, contact the Nevada Center, 1231 Country Club Drive, Carson City, Nevada, 89703, or call us at 775-884-3990, and be sure to visit our website at www.antiagingmedicine.com.